Hello, and welcome to our second episode of AADI video series, Let's Talk About. In this video series, we talk about many topics we're all wondering about, such as living with diabetes, how to take care of ourselves, and even just day-to-day stress about different uncertainties and much more. I'm Julia Lee, the Asian Clinic Coordinator at Joslin Diabetes Center. I serve as a liaison between providers and patients. I help with appointment scheduling and look into when medication is not covered by the insurance. Today, we're going to focus on the stress of living through a pandemic and with the uncertainty of how things will pan out with COVID. These thoughts and things can put even more pressure on us. I'm excited to welcome back Dr. Persis Commissariat again with us today. For those who may have missed the first episode in the video series, Persis, can you introduce yourself?
Yeah, absolutely. So as Julia said, my name is Persis Commissariat. I'm a clinical psychologist and a certified diabetes care and education specialist here at the Joslin. I actually work in the pediatric clinic and I see children, teenagers, and young adults with diabetes as well as their families. And I think I mentioned in the last video, I've also lived with type 1 diabetes for over 20 years myself.
For those who may have missed episode 1, we talked a lot about physical and emotional stress of living with diabetes and how to manage it. In today's episode, these are the topics we will cover. With COVID-19 and the Delta variant, I think many people are worried about the upcoming cold months. Some people might feel hesitant about leaving their homes and taking public transportation, or just being out in public places. When Joslin resumed in-person appointments, many patients felt hesitant about coming in and seeing their doctor, with COVID being one of the main reasons. Some patients have not had any blood work done since the start of COVID. While we offer telehealth appointments, it certainly cannot replace face-to-face visits with their doctor. It is important to come in and have the blood work done if you haven't done so during this past year. Persis, what can we do to alleviate some of the worries that people might have about stepping outside?
Well, I think it's important, first and foremost, to just follow these guidelines on going outside in public places. So this would include things like wearing masks in indoor public places and just practicing personal hygiene, like wash your hands when you get a food delivery and things like that. I know there's no longer specific guidance on social distancing, but it certainly couldn't hurt if people want to continue doing that. And of course, getting your COVID vaccine is essential to protecting yourself. I think, Julia, for those who are nervous about coming into Joslin for visits, I hope that people will take some comfort in knowing that Joslin actually has quite a few protocols in place to help keep people safe, including wearing masks while you're indoors. They have ample hand sanitizer available, and there's even a person at check-in who will ask questions about whether you have any symptoms of illness and turn people away if you do. It's so important to come into clinic for your diabetes care because nobody wants any of our patients to sacrifice their health. You don't want to sacrifice your health to COVID, and you don't want to sacrifice your health to diabetes. So I always tell people, do whatever you can to keep safe from COVID and attend your visit so that you can stay healthy with diabetes as well.
That's great, thank you. At Joslin's Asian Clinic, we recommend getting the COVID-19 vaccine. However, I have heard from some patients that they're worried about being around unvaccinated family members. And now that we're approaching holiday season, that might mean more holiday gatherings with your family. There seems to be a lot of stress and disagreements within families, which brings on even more stress and anxiety among yourself. What would you recommend to those who have family members or people around them who are very hesitant about getting the vaccine?
That's an interesting question. It's not an uncommon concern. I think it's actually something that has come up in many of my visits over the last year. I don't have any specific generic advice because I imagine that people's stress and anxiety could be due to any number of issues. Like, are they worried about their family member getting them sick? Or are they worried about the family member themselves getting sick? Are they upset because they disagree about vaccinations and they feel really strongly? And unfortunately, I think sometimes it's hard for us to wrap our heads around, but there's a limit in what you can do to change another person and how they feel. I think it's very important that all of us are able to express our worries and our beliefs, but we want to do so in a way that's not, rude or condescending, not threatening or no accusations towards your family members. So, for example, it's probably not helpful to tell a family member like, oh, if you don't get the vaccine, you can't see me or my kids ever again. Because your family member may react really poorly to that. They may feel hurt and offended, and it worsens the overall relationship. So instead, I would recommend trying to explain things from your perspective in saying that I'm really worried about my health and I don't want anything to happen to you either. It would mean so much to me if you were vaccinated so that we can spend time together again without arguing. So that's just one example. There are probably many other ways to address this, but hopefully in being able to share your side of things, it'll help open your family members' eyes as well, and at least considering how you feel. And if your family member still refuses to get vaccinated, as hard as it is to believe, you may have to accept that everyone makes their own choices and instead focus your efforts on protecting yourself and others from COVID by wearing your mask and distance when you can, because it'll protect both you and them.
I think those are some really good tips to keep in mind for everybody. This past year and 10 months has been a lot, I think, not with just contracting COVID or managing diabetes or your overall general health. We have seen so many disturbing incidents in the world, such as the death of George Floyd and the rapid increase of anti-Asian violence. It sparked nationwide protests and is affecting how we feel about our everyday lives. Can we talk a little bit more about this, Persis?
Yeah, absolutely. I think this is such an important topic to address. I've heard from others that it's both terrifying and a little bit unreal to suddenly feel unsafe in your own environment, especially hearing reports of unprovoked attacks, like really just no reason this should be happening. It actually reminds me a lot of the rapid increase in hate crimes towards South Asian and Middle Eastern people following 9/11. It almost seems like these horrible events, both 9/11, 21 years ago, and now COVID, it's triggered a lot of misplaced anger so that now people feel targeted for something that's not their fault, but they are targeted based solely on how they look and who they are, which is so difficult to wrap your head around and so disheartening to see. And it's just very upsetting to know that just it's driven from a place of ignorance and misplaced anger that has morphed into violence.
I completely agree with you. I think the misplaced anger is just too common. And with the rise of anti-Asian hate, we saw news about seniors being attacked during broad daylight, Asian people being avoided in public, or even verbally or even physically assaulted simply because they're wearing a face mask to protect themselves.
Yeah.
Personally, for me, I was worried about my family members leaving for work, running errands, and going grocery shopping. I remember for myself, back in March 2020, I was heading home after Joslin announced its remote work for employees. I wore a face mask on my way home to take the bus. When I stepped onto the bus, I could immediately sense other riders glancing at me. I wondered if they were all thinking along these questions. How come she is wearing a face mask? Is she even sick? I didn't want to sit down, so I opted to walk towards the back door and wait until I got off my stop there. While no one verbally said anything to me during the ride home, it just felt weird to have this feeling that everyone's staring at this Asian girl with a face mask on.
Yeah. Yeah, that must have been really difficult to manage. You did it because all you wanted to do was live your life safely, and instead you got this silent judgment for it.
Yes, exactly. I hear this from our patients often who are worried about keeping themselves safe from both COVID and COVID-19 related violence in the outside world. How can people deal with these feelings of helplessness?
Well, I think the natural counter to feeling helpless is to feel empowered. So maybe the question really becomes, how can we empower people to continue living their lives safely? Which is a really big question. And so I don't have all the answers and certainly can't address every situation, but I assume that there's more fear in going out in public. So it may be helpful in cases like this to take a bit of a problem-solving approach. So if your fear is to go out in public, we try to solve the problem at hand. So our first step is to, identify specifically what's the problem that you're worried about in this situation, in going out in public. And once you can identify a specific problem, then we think of what would make you feel better in this situation. What needs to change in order to make this problem a little easier to solve? Then your next step would be, once you know what needs to change, let's find some potential solutions. Let's try to implement those changes in some way. And then our next step will be, you have this list of solutions, we try one, and then finally just retry as needed. Something works for you, something doesn't. That being said, like as I've listed all these things out loud, I recognize that there's also a lot here. So would it be helpful, Julia, if we walk through an example?
I think that would be really helpful. So one example I hear often is that people are reluctant to come into their medical visits because they're worried about being the target of violence on their way into the appointment.
Okay, that's a great example. I imagine it probably resonates with quite a few people. So going through the steps that are listed on the screen, the first step that we take is, as I said before, we identify what's your specific worry in this situation. So Julia, you just gave the example of people don't want to come to medical visits because they're worried about being the target of violence on their way. So is our specific worry about violence related to, being around a lot of people on public transportation, like perhaps chances of violence increase there? Are you worried about wearing a mask in public because it might draw more people to you? Or is it just a specific neighborhood or area on the way to the appointment that you worry about that feels unsafe for you? So we first identify what is it that's making you feel this way? What's making you worried about being the target of violence? Where is that violence coming from? So then our next step is to determine what's going to make people feel better and feel safer coming into their visit. So for example, if your patients take public transportation, would they feel safer if they didn't have to? If public transportation wasn't their means of getting there anymore? Would they feel better if they had a friend or a family member with them so that they didn't have to travel alone? Would they feel better if people didn't recognize them? Like if they could cover up as much as possible so that nobody gets triggered by you or how you look? Maybe there's an option to take a different route, like perhaps the areas in which they're traveling through tend to have more violence, and would they feel better if they took a different way there? And I give all these examples with the understanding that people may need multiple things in order to feel safe, and that's okay. It's okay. You identify as much as you need to feel better in this situation. So then going on to our next step, number 3, once people know what would make them feel safer, I would encourage them to come up with as many potential solutions as possible. So for example, if people feel safer attending the appointment with another person, then the solution may be to ask a trusted friend or a family member to come with you. Schedule or reschedule your appointment so that it fits both of your schedules. If public transportation feels unsafe and is an issue, consider taking a taxi or getting a ride from a friend. If the area that they are walking or traveling through feels unsafe, we can recommend perhaps carrying a whistle or sharing your location on your phone, like using some GPS tracking to share your location with a trusted friend or family member, just so that someone will always have tabs on you. We could even offer the recommendation of maybe moving your appointment to the morning when it's sunnier outside and it's easier to keep an eye out on things and avoid violence that way, instead of having an afternoon appointment, especially now that it's started to get dark at 4:30. But these are all options of potential solutions. So now, once people have all of these potential changes that they could make, our next step is to try them. As I said before, people may need multiple things in order to feel safe. So they can try one solution at a time, or they can try a few things at once. It's just that everybody is so different that it's most important to do whatever helps you feel safe in that moment while still being able to accomplish your daily activities. So if you'd like to move your appointment to the morning and take a taxi, because that's the only thing that would get you in to your appointment, do it. That's the way to go. It's whatever makes you feel well enough to accomplish whatever you needed to that day. And then the final step would be to just assess how these solutions you tried actually work for you. So, were you able to make it into your appointment? Did you feel any safer doing so? And could you do it again? Because you can implement solutions, but if they don't work for you, then they were the wrong solution for you in your situation. So you try something else, or you try a combination of things the next time. And once you find something that works for you, you can continue to use it as often as you can.
Thank you, Persis. Thank you for walking us through those steps and the different approaches that we can take. And I hope this is something our patients can try as well. What would you recommend for people who may have trouble identifying their specific worry or coming up with solutions?
That's a great question. I feel like it's really easy for me to spit them out because I do this a little more often, but the method is effective. It's just not always easy to do alone and can be really difficult the first few times. So your fears and your solutions will also vary based on whether you're worried about experiencing violence for the first time or if it's already happened to you. So I think perhaps the easiest first step, if you're having some trouble, is to brainstorm with another person. You can ask a friend, you can ask a family member, anyone who you think might understand the way you're feeling. It's also, just putting this out there, so important to remember that your Joslin team is here for you also. And in fact, we have a behavioral health department here. I think I spoke about it in our first video as well. And our department is an excellent resource and can really help people process their fears and find solutions that fit their needs, because the solution has to be effective for you. And sometimes it takes a little bit of practice to know like what's going to be the best fit for you, your preferences in your life. So our behavioral health team is also an especially important resource if you've experienced violence before, because the actual experience of having this anti-Asian violence can be a lot to hold on to and sometimes very difficult to move past on your own. So having the right support and even professional support can be essential in moving past your fears.
I think those are very helpful tips. It's definitely important to continue seeing your healthcare providers, and we hope that today's episode can help just outline and provide you with the support for when you're stepping out and helping relieve all the stress and anxiety you might have about just being outside or taking public transportation.
Absolutely.
We have created a list of helpful information for you to view or download on our website. Please take a look and share with anyone who may find it useful. If you're an Asian clinic patient, all of you will be getting this information in your patient folder. If you have any questions to Persis or Joslin's Asian Clinic, please contact me. We are planning to create a series of videos like today's. If there are any topics you're interested in hearing about, please send me your suggestions to the AADI email. Persis, thank you so much for joining us today.
Thank you for having me.
Our next video, we will be talking about pregnancy and babies. And some of the topics that we will cover include if you are starting to plan for a baby, or if you develop gestational diabetes during the pregnancy, or what to know about conceiving and pregnancy if you have diabetes. Stay safe and well, and we'll see you in the next video. Bye.